So this is really about pressures in the whole cardiovascular system. And I've already mentioned this, but the key point here is that blood flow will flow in the direction of lower pressure. Remember that, let's go back. Remember that key equation I told you about, where flow equals to the pressure gradient over resistance. So these are the two factors, the only two factors that will determine where blood will go. Now I want to define a couple extra terms for you. The next one is mean arterial pressure. So mean arterial pressure is basically, this equation, cardiac output times total peripheral resistance, just tells you what factors affect the mean arterial pressure. So if you have more cardiac output, you have more blood in the vascular system, so you're going to increase your pressure. Other thing that increases it is total peripheral resistance. If you have higher resistance, which means that your vessels are clamped down, they're constricted, again that will increase your pressure because you've decreased your volume. So the way we can calculate this from just a simple blood pressure measurement is we take 2/3 of the diastolic pressure and we add 1/3 of systolic pressure, and then we divide all of that by 3. Because 2/3 of the time the heart is in diastole and 1/3 of the time is in systole. So with this equation we can get the mean arterial pressure. Final term I want to define is called the pulse pressure, which is something you might hear about later. And the pulse pressure is essentially the difference between systolic pressure and diastolic pressure. And we care about this because it can be changed by various pathologies. So this pulse pressure can be increased, is proportional to increases in stroke volume. Because the higher stroke volume will increase the systolic pressure, because there's more blood that will come out during systole. And then it is inversely proportional to arterial compliance. Okay, I want to make this clear. If you have a more compliant artery, which means that it can stretch out more with more blood, this will decrease your pulse pressure. Because the higher the compliance, the less the diastolic pressure will decrease after systole. It keeps that energy better. It's like a spring. It keeps all that energy, and the diastolic pressure will remain similar to the systolic pressure. Now, if you can remember these two, you can predict how different pathologies will affect the pulse pressure. So first, if I ask you how exercise will affect the pulse pressure, what would your answer be? Well, your answer should be it should increase pulse pressure, because exercise will increase stroke volume, because your heart's beating, it beats faster and it squeezes better. You increase your stroke volume, and thus you increase pulse pressure, which I'm going to call PP. How will aortic stiffening affect pulse pressure? Well, aortic stiffening is going to make your artery, it basically means your artery is less compliant. Remember what we talked about that? What we said about less compliance? That means it's going to not hold all that energy, which is pressure. In fact, it's going to get lost, so your diastolic pressure is going to decrease, so your pulse pressure is going to increase, because there's a bigger difference between systolic pressure and diastolic pressure. Aortic regurgitation, how will that change? How will that affect the systolic pressure and the diastolic pressure? Well, I haven't talked about this yet, but aortic regurgitation will increase your systolic pressure. It's going to decrease diastolic pressure, because once blood pops onto the aorta, some of it can go back into the left ventricle during diastole. So you're going to increase pulse pressure here. Now, how about aortic stenosis, which I haven't talked about either? But this can be changed. This can change pulse pressure, because how will that change pulse pressure? Well, in aortic stenosis, you're going to have lower stroke volume, because the valves are stenosed, so less blood can come out of the left ventricle. So if you have decreased stroke volume, what happens to your pulse pressure? Remember, it's proportional, so you're going to get a decreased pulse pressure. Cardiogenic shock, or let's say heart failure. In heart failure, what's going to happen? What happens to your stroke volume or arterial compliance? Well, stroke volume goes down. Remember, your heart failure is where the problem where the heart pump stops working, so you're not pumping very well. So stroke volume goes down. Again, pulse pressure goes down. So you don't have to memorize any of this. You just have to understand how each of these pathologies changes either stroke volume or arterial compliance. So these are the two things you want to think about: stroke volume and arterial compliance. You will be able to predict how pulse pressure will change. And this might be important. You might be asked about this. So that's it for our cardiac pressures. Actually, we're going to keep going a little bit, and we're going to look at the pressures in the heart, in each chamber of the heart. It's actually very simple. It's going to be very quick. So in the right atrium, the pressures are going to be around 5 millimeters of mercury, okay? And in the right ventricles, it's going to be 25 millimeters of mercury. So it's all very round, even numbers. And because the ventricle is going to squeeze, it's going to pump out straight into the pulmonary artery, we're going to get the same numbers in the pulmonary artery, 25 millimeters of mercury. By the time the blood gets back to the left atrium, you're going to get the pressure of 10 millimeters of mercury. And the left ventricle is very high pressure. It's 125 millimeters of mercury. So you see that these are all very even numbers. They're factors of 5, so you should be very easy to remember. And this is 125 because you need to at least equal or exceed the pressures in the aorta. Remember what a normal blood pressure is. It's around 120, 130. So that's what we're going to call this here. Okay? Now, the other thing I want to note is that the left side in general is lower. This is the right side. Right pressures are generally less than left pressures. And the ventricles always have higher pressures than the atria. So that's general principles. That helps you remember these numbers if you can't commit them to memory somehow. Finally, a way we can calculate the left atrial pressure is through something called the pulmonary capillary wedge pressure. Pulmonary capillary wedge pressure. This is when we obtain this pressure. We place a catheter into the pulmonary artery. Okay, we stick a catheter all the way in into the pulmonary artery, and we completely occlude it. And then we measure the pressure distal to the occlusion. And because it's completely occluded, this pressure right here is going to be equal to whatever is downstream. So downstream would be this stuff, the left atrium. So the pulmonary capillary wedge pressure is a direct measurement of the left atrial pressure. Again, we occlude the pulmonary artery and we measure the pressure right distal to that occlusion. And because we have this occlusion, it's like a vacuum, we can create a vacuum seal. So this pressure here will then be exactly equal to the chamber proximal to it, which will be the left atrium. So that's it for our heart pressures.